Hello everyone, I am Dr. Sanjay Soni, M.S ENT graduate from Maulana Azad Medical College, and today I would like to discuss with you about ENT as a career option or a branch. So often MBBS graduates have this incomplete or inaccurate idea about ENT as a branch, and this is primarily because our undergraduate teaching of ENT in most of the colleges revolves mainly around one disease, of course, CSOM. So in internship also, there is not enough exposure. But in reality, the branch is very versatile. It deals with the diseases of ear, nose, and throat. And of course, there are malignancies of head and neck, which are the most common malignancies in our country. And also diseases of parotid, thyroid, and submandibular glands. So talking of pros, first and foremost, it's a surgical specialty, an evergreen branch. Second, ENT has good work-life balance. Majority of the cases are routine cases, they are not emergency cases, and hence they can always be scheduled at day and time of your comfort. Third, ENT has excellent scope for OPD practice, for routine OPD practice, and there are innumerable conditions pertaining to ear, nose, and throat. So, if at some point you just want to continue with OPD practice, that is also an option. So as far as super specialty is concerned, there are multiple options available. One can opt for formal MCH courses in MCH head and neck oncosurgery or surgical oncology. Along with that, there are multiple fellowship programs available, like for example in rhinology, fellowships in anterior skull base or lateral skull base, in cochlear implant surgeries, or in vertigo or allergy. And these fellowships, they range, the duration ranges from 6 months to up to 3 years. So the residency routine depends primarily on the kind of hospital that you're working in, and also the volume of patients that that hospital caters to. But more or less, a first year PG is learns the most basic things about the subject. He learns about how to run the OPD, the methods of examination, the documentation and the ward work, and how to correctly diagnose and manage the most basic conditions of the subject. Also, as far as surgeries are concerned, the first year a resident may get to perform uh, adenoidectomies, tonsillectomies, tracheostomies, or steps in myringoplasties. In second year, we usually get septoplasties or cortical mastectomies or dacrocystorhinostomies, endoscopic DCRs that we call. Then the third year residents are expected to have good theoretical knowledge of the subject, and they get to assist in major surgeries like head and neck cancer surgeries, thyroid or parotid surgeries. So speaking about cons, there is hardly any con as such, but I would say the surgical learning curve in ENT is a little longer because the core ENT surgeries are either microscopic or endoscopic. So it takes a while before you can actually learn and master them and actually perform them independently. Second, the ENT surgeries involve very precise work. We work in very small areas and there is hardly any margin of error. Third, if you're planning to settle in a metro city, then definitely there is some saturation, which is true for any given branch. But if you are ready to settle in a tier 2 or tier 3 city, then the demand for quality ENT surgeons is quite high. So, well, stipend actually varies from state to state, and also at times it varies between colleges within the same state. In Delhi, it is about 80 to 90 K per month, and also there is no bond. Apart from that, in other states, it's between 60 to 70 K. Well, which college to select is usually a personal choice, but the thumb rule is that you should always look for those colleges who that perform head and neck surgery cases routinely along with ENT cases. You should prefer ENT in those colleges that have good head and neck load along with general ENT load. Also, we have two options, MS versus DNB. So MS in general has more hands-on because it is offered in government colleges. If you're opting for DNB, make sure that it is either a teaching hospital or a government hospital which is offering a DNB seat, because there the chances of getting hands-on are much more compared to a private hospital. So I hope we could clear some of your doubts and that you'll make a more informed decision now. So thank you. All the best.